Well, joining us now is Dr. Carolyn Bennett, the Minister of Mental Health and Addictions. Minister, thank you for joining us.
It's great to be with you.
You know this. Pierre Poilievre says that you and your government are essentially perpetuating a crisis here by subsidizing these drugs and giving users access to them. How do you respond to that?
Well, I think the evidence doesn't show that at all. He has some anecdotal stories that is making actually the safe supply community pretty annoyed, as we saw in the London Free Press today. It is about doing what works. This is a very different situation than it was even in 2019. The drug supply out there is poisoned and people are dying using. And so it's about replacing this poison drug supply with a pharmaceutical grade medicine so that they can stabilize and so they can think about life differently from the hustle. And it, you know, I was thinking, Michael, that 40 years ago people fought against methadone. 20 years ago, people fought against Suboxone. More recently, there's the possibility of Sublocade. But this is about keeping people alive long enough because people are dying. And the people that are in the safe supply programs are people who are losing their friends. And they've decided to try something new, to step inside to a health setting where somebody knows their name, somebody cares about them, somebody really cares that they don't die, and are prepared to offer them the kinds of supports they need. 46,000 overdoses have been reversed in safe consumption sites. That also gives somebody using drugs the opportunity to develop a trusting relationship such that they can actually get the hope that allows them to make real choices in their life going forward. So,
okay. Well, let me ask you to do a compare and contrast here, because you know the argument that Pierre Poilievre is making is that he would like your government to essentially take the money that's being invested into this safe drug supply, reinvest that money instead into treatment and social programs. He calls that common sense. How do you compare and contrast what your program does versus what he says should be the priority here?
Well, I think that we lived for 10 years with the Conservative government taking harm reduction out of the internationally accepted drug policy, which is prevention, harm reduction, treatment, and enforcement. So what we now know is that the people on the ground, the people with lived and living experience, are furious that this debate is even continuing to polarize harm reduction versus treatment. Everybody knows we need both. We need treatment and we need aftercare and we need social supports and housing and all of the things that help with the complex conditions where people with severe mental illness who are using substances need to stay on their medicine for their mental illness as well as get supports for their substance use. This is so stigmatizing for this debate to continue as though it's either or. That people with the opioid use disorder need treatment like any other medical condition, and it means compassion, it means somebody who cares about them, and somebody who will follow the evidence to get them the best care possible.
Okay, I'm going to ask you another point that Pierre Poilievre makes, because he argues that the safe drug supply that again is subsidized is actually being resold so that users can use that money to buy the drugs they actually want, things like the drugs that are laced with fentanyl. What do you say to that? Because it's actually not just Pierre Poilievre, but that's also been reported by other media.
Diversion is an issue, there's no question, but diversion is an issue with prescribed medicine from the doctors and from the pharmacy. That this is about a problem, but selling drugs is illegal. Diversion is illegal. That is something that has to be dealt with differently than how we get people to be able to stay alive long enough to be able to get comprehensive care. So it's a matter of that, and I think in the piece today with Dr. Serapio, I mean, to be selling what they are saying as very cheap drugs in order to buy drugs that are more expensive, there's not a lot of evidence for that. But there is evidence of diversion, and we will address that with enforcement. But that doesn't mean that you can't give people compassionate care and get them the kind of treatment they need in order to be able to stabilize and get on to a better life. So it's actually quite heartless, and what the parts of the debate today were so infuriating in terms of this stigma, how this is stigmatizing people that use drugs. We're supposed to be lowering the barriers so that they can see their path to being able to step inside and go to a safe consumption site, go to a safe supply. And I keep asking, if safe consumption has reversed 46,000 overdoses since 2017. What do you say to those people that wouldn't be alive today, like Guy Fitzgerald and the people who have overdosed a number of times and now are on a good path?
Yeah, I'm sorry to interrupt, but how do you square that then with the number that the Conservative leader was quoting in the House, this idea that the number of opioid deaths have actually gone numerically up year after year?
Well, to be fair, Michael, it went down a tiny bit in 2019. And then we had COVID and all of that, where harm reduction was more difficult to access. But mainly, that is when this poison drug supply came in. That it used to be that people would use drugs for a long time and die of something else. Now this drug supply is so poisoned that you have people who've fallen off a roof and are on medicine, and they get cut off their meds and they go to the street for their drugs and they are dying. And so this is, I think the stigmatization and just the lack of compassion about people using drugs. And when you look at Moms Stop the Harm, or the people who are really proposing the kinds of changes in policy that we and so many governments across the country are trying to do, is actually evidence-based. And I don't think that I'll take the articles in the CMAJ to help me decide what to do, not an article in the National Post.
Which I understand. I'm quickly losing time, but I do want to ask you, given the fact that this was debated in the House today for quite some time, I'm wondering if there's any point that was raised whatsoever by any opposition member, Conservative otherwise, that you perhaps will consider, perhaps reevaluate about the program and how it's delivered?
I just hope that the Leader of the Opposition will meet with the Moms Stop the Harm when they're here on the Hill on June 1st. I think they need to read what Ben Perrin is writing and saying in terms of this failed Conservative ideology. He was the public safety advisor to Stephen Harper. That people are changing their minds in a good way in terms of stopping the stigma and following the evidence and dealing with people using drugs with compassion and trying to keep them alive.
Minister Bennett, really appreciate the time this evening. Thank you for that.
Thank you.